A regular treadmill stress test is when the patient has electrodes hooked up to their chest wall, and we want them to exercise or stress the heart while we read the EKG tracing. A regular stress test is heavily dependent upon the interpretation of these EKG changes that might be produced during exercise. If the person is unable to walk on the treadmill, we can also give an inotropic agent to stress the heart and check the EKG for changes as well. That's referred to as a non-treadmill stress test. We can also add cardiolite to the stress test, and this is actually nuclear imaging of the heart, where the patient will exercise on a treadmill to stress the heart if possible. Otherwise, we can give an inotropic agent to stress the heart. Then thallium, which is a radioactive isotope, is put into the IV when the target heart rate is reached. The thallium moves through the blood and goes into heart muscle. The heart muscle that does not have enough blood supply takes in the isotope slowly or not at all. So an hour after exercising, this nuclear imaging department can take scans of the heart and show areas of narrow or blocked vessels or areas of damaged heart muscle. And it's important to consider before a cardiolite stress test that the patient remain MPO except for water for 4 to 6 hours. They're to have no caffeine for 24 hours, and they're to take no medications over the counter or prescribed that contain any caffeine for 24 hours. No smoking or chewing tobacco for at least 6 hours before the test. And the physician may order some heart meds such as beta blockers be held 48 hours prior to the test. So cardiac catheterization is another way for us to view the vessels in the heart. And a guide wire is inserted into the femoral artery of the leg and threaded up into the aorta. A catheter is then inserted along the guide wire. Once in place, a dye that can be seen on X-ray, which we refer to as contrast dye, is injected into the bloodstream. So areas of narrowing can then be seen. Coronary angiography is a part of the cardiac catheterization, where we take pictures of the coronary arteries when they're full of the contrast dye. Here we see an example of balloon angioplasty. This is another part of the cardiac catheterization if there's a narrowing of the artery and we want to open that narrowing. A stent is another way to open up the narrowed vessel. It's a wired mesh tube that is inserted during cardiac catheterization to open up the narrowed vessel. So remember, angiography is the same thing as arteriography. So coronary angiography refers to the coronary, heart, angio, which are blood vessels, and graphy, which means picture or image. So a coronary angiogram is done as part of the cardiac catheterization procedure, and it produces a visual X-ray image that identifies narrowing or blockage in one of the arteries. Angioplasty, which we looked at in the video, is when we mold or form through surgical intervention the inside of a blood vessel. And this involves temporarily inserting and blowing up a tiny balloon where the artery is blocked to widen the artery. A wire metal mesh tube is used to prop open the artery during angioplasty. It is collapsed into a small diameter and put over a balloon catheter. It's then moved into the area of blockage. The stent stays in the artery permanently, holding it open, improving blood flow to the heart muscle and relieving symptoms, usually chest pain. Remember earlier, which we refer to as angina. So within a few weeks of the time the stent was placed, the inside lining of the artery, or the endothelium, grows over the metal surface of the stent. Some stents even contain medication that keep new clots from forming. After a stent is placed, many patients need to take medications. Plavix is a medication that inhibits platelet aggregation. Aspirin, a dose of 80 to 325 milligrams, actually also inhibits platelet aggregation.